So we are discussing in food and nutrition balanced diet. Yesterday we discussed the balanced diet basics thing. Today we'll continue the topic. So basically I explained that RDA chart. Okay. In that chart we have, I will show you the chart. So this is the FDA recommended guidelines by ICMR, Indian Council of Medical Research. Okay. So here you're able to see the everything man, woman, infants, children, boys, girl, different age, sedentary, moderate, heavy, all these are there. Weight, okay, and energy requirement, protein requirement, the fat requirement, calcium requirement, iron requirement, vitamin requirement, thiamine, riboflavin, niacin, pyridoxine, ascorbic acid, dietary fiber, vitamin B12, magnesium, zinc, all are available. Most important, uh, all the vitamins are available in this chart. So basically, uh, if you follow this, okay, good, okay, but they are the limitation of this guideline. Okay, what are the limitation? I will explain. Okay, and what we have to do. The limitation is when this chart is they provided, they try to provide the chart. So basically, they focused on mostly on they gathered the data from men according to requirement of men, adult men, and according to their they adjusted according to the age, sex, pregnancy, lactation, everything individual. Okay, first thing is. Second thing is that nutritional interaction. Nutritional interaction means here the recommended diet is okay. They explain, but when you are taking two different types of vitamins, one vitamin absorption will reduce due to the presence of another vitamin. So there are most my example are there like absorption of vitamin D can be influenced by vitamin K. Okay, and iron can be affect the absorption of calcium and zinc. If you take iron, calcium, and zinc at a time, what will happen? Calcium absorption will reduce. Zinc absorption will be reduced. So this is not explained in this diet chart. Okay. Third thing is that absence of certain nutrients. Like we have essential nutrients, but not all essential nutrients are explained in this chart. Some micronutrients which are required little amount, like vitamin K1, okay, vitamin K2, omega 3 fatty acids, okay, because they are very beneficial for our health. We need that, although they are important, but even not explained in this chart. Okay, because they mostly focus on disease, how to uh, prevent the disease. They are the main goal of this RDA chart. Okay, so what we have to do? We have to include all those things as a nutrition. Okay, we have one system that is called food exchange system. Food exchange system means if you're planning a diet, some patient I asked you to plan a diet, but I am a vegetarian. So now you have to what to do? Which are the most important source of protein food? You have to avoid all those things. You have to wrong mark on those, and in that place you need to exchange of food. exchange of, if a person is non-vegetarian, there is no problem. Then you can easily advise the patient different type of foods, and he can easily take that. But if a person is vegetarian, okay, you need to change the food which are having the proteins in those foods in that place which are eaten by the person. Okay, so many number of person don't like taking eating any food. Some doesn't like eating chapati, some doesn't like eating rice. Okay, so what we have to do, we have to exchange those food with another food to regain the benefits of food. Okay, so according to the category, we have to design that. According to flexibility, we have to need to know that. Okay, so basically this is the food exchange system which will work. Like example, one example is that if a person is eating fruit, another example, some person like apple, some persons like banana, some persons like berries. Now if you tell that patient, so what you happen, if you are not eating banana, in plate of banana you can eat apple, in that place you can eat berries. Like that you have to exchange the food. So like in uh, starches, fruits, okay, milk. Even some persons doesn't like to drink milk. Okay, what you have to do, you have to some persons need low fat milk, fat free milk, whole milk category, whole milk. Okay, that you have to consider. In that vegetable, same in vegetables also. Okay, non starchy vegetables, low carbon content vegetables. Okay, so this is we have to do in that balanced diet. In same in me in non-veg also, some persons doesn't like to eat chicken, okay, or red meat. Okay, you have to adjust that, balance that. Fats also. Okay, so everything you need to exchange, and keep, you have to keep in that mind that the person is getting that enough percentage of diet or not. Like one more example I will give here. Milk, like milk exchange. One person is taking, we have to know the nutritional value also. One person is there, he doesn't want to take cow's milk, he only likes buffalo milk. So you need to know how much the required amount is that to the person. For example, if you take 250 ml of cow's milk, in that you will get 8 grams of protein, 12 grams of carbohydrate, and 10 grams of fat. Okay. If you go through with another milk, so you will get in 165 ml only, you will get 8 grams of protein, okay, 12 grams of carbohydrates, 10 grams of fat. So in the cow milks, you need to take extra amount. In buffalo milks, only 165-gram milk is enough. Okay. So you need to take not 165, 185, 185 ml. That is enough. You will get 8%, 8 gram of protein. Carbohydrates, fats are more than cow's milk. In the cow milk, you will get 10.3 grams only, but in buffalo's milk, 16.3 grams. Okay, we have different types of milk: skimmed milk, whole milk, powder milk, buttermilk, curd, cheese, etc. So these are the exchanging things. We need to know that. Okay. So this is the food exchange tips we need to understand. Next is calculation of the nutritive value of foods. We need to understand how much amount of, if you are giving a fruit, how much amount of carbohydrates is present. Vegetables, 100 grams. Sweets, you're taking 100 grams of sweet. How much amount of carbohydrates is there? Okay. So if you need to convert into calories, so 1 gram of carbohydrates is equal to 4 calories, 4 kilocalories. Again, 1 gram of protein, 4 calories. 1 gram of fat is equal to 9 kilocalories. So this is the difference between 1 gram of calories, 1 gram of protein, 1 gram of fat. So every time you need to check that how much amount of carbohydrates is present in that food. If 100 grams of fruit, 20 grams of carbohydrates is present, so it means 20 into 4, 80 calories. By eating one fruit, you are getting 80 calories. This is the important thing. Not only macronutrients, micronutrients also understandable. Not only vitamins, in minerals also. Like we have A, D, E, K, calcium, potassium, sodium, etc. Okay. So this is the very important thing. And you need to include the diet, which is very important for our body to release the toxicity from the body, stool in the form of stool. The okay, you need to take fiber diet. Okay, fiber diet and water. These are the very important things. Okay, you need to understand. So, what are the different types of fiber? I will explain here because very important. One is fiber because here in the diet, balanced diet, fiber is explained. Dietary fiber, not fiber only, dietary fiber. Okay, we have two types of fibers. One is soluble fiber, another one is insoluble fiber. Insoluble fiber is will dissolve in water. Okay, and it is present in oats, peas, beans, apple, citrus fruit, okay, carrot, barley, and phylum. Okay, and insoluble does not dissolve in water. Number one, helps add bulk to the stool and is found in whole wheat flour, whole wheat flour, wheat bran, nuts, beans, and vegetables. So in that insoluble fiber, they are excreted from the body. Okay. Roles of digestive fiber. What is the role of digestive fiber? It is for good for digestive health, promotes regular bowel movement. Number one is regular bowel movement, very important. And constipation, prevents constipations. Okay. And blood sugar, also control blood sugar level. Okay. Slow because it will absorb very slowly. So the amount of level of carbohydrates in the blood is maintained, helping to control blood sugar levels, particularly for diabetic patients. Okay. And the fourth is cholesterol management. Soluble fiber can help lower total blood cholesterol levels by lowering low density protein or bad cholesterol level. So here LDL will increase, HDL will decrease. High density lipoprotein is very not good for health, will damage, and it will cause mostly clots in the body. And weight management, if you want to weight manage, then you need to take dietary fiber regularly, because high fiber foods tend to more filling. Thus, they can people stay fuller of longer and reduce calorie intake. Means if you take regularly, what will happen? The amount of eating food will decrease because it will stay longer duration in the body. Gut health, for the gut health also is very important. Fiber is important for maintaining health gut bacteria balance. How much required? 38 grams. 38 grams up to age 50 years. After 50 years, you need 30 grams. For women, 50 years, 25 grams and 21 grams per day. Okay. What are the dietary source of fiber? We have fruits like apples, bananas, oranges, strawberries, raspberries, vegetables, carrots, beetroot, broccoli, collard greens, Brussels sprouts, legumes, lentils, black beans, bean, kidney beans, chickpeas. Whole grains, in whole grains, what we will get? In the whole grains, whole wheat flour, barley, brown rice, bran flour. ठीक है. Nuts and seeds, almonds, flax seeds, and chia seeds. Healthy beneficial. Already I told you that it will prevent the bowel disorder, cardiovascular health will improve. Okay. Weight management, overall gut health. Overall gut health will also improve. Okay. So this is the importance of dietary fiber. So you need 38 grams per day, and for after 50 years, 20 30 grams according to the condition. Okay. We need dietary fiber. I think you got the answer for balanced diet. Okay. Some sort of things will be cleared, and we have much more to learn. Next, we will plan the meal planning, menu planning. Okay, we will talk about definition, principles, and steps to make balanced meal in coming class. If anyone have any doubts, kindly ask.